Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us again. Going to be speaking with Dr. Michelle Goveia this evening and Dr. Monica Mercer. They're joining us here on the program to talk about some new data that was presented at the IDWeek 2020 virtual meeting, discussing physician and parental attitudes about the use of early childhood combination vaccines and a bit about the potential implications for timely completion of the CDC recommended child and adolescent immunization schedule. Welcome to Health Professional Radio, both Drs. Goveia and Mercer. Thanks for joining us this evening.
Thank you.
Thank you.
Dr. Goveia, if you could give us a bit of your background and talk about what it is that you do and where it is that you do it. And Dr. Mercer, if you could do the same for us.
Sure. My name is Michelle Goveia. I'm a pediatrician who has worked at Merck for 18 years in our clinical research and medical affairs department. And I'm currently supporting all of Merck's pediatric and hepatitis vaccines globally to help ensure access amongst children across the world.
And Dr. Mercer?
Yes, absolutely. Hi, I'm Monica Mercer. I'm a family medicine physician by training. I work at Sanofi Pasteur. I'm one of the physicians that works in the medical affairs department supporting our vaccine portfolio. I've been there for 6 years, and more specifically, I work on our pediatric portfolio that supports the varicella vaccine.
This data that we're going to talk about briefly this evening that was presented at the IDWeek 2020 virtual meeting, what are the implications of using combination vaccines, especially in early childhood?
So, when we think about, I think most importantly, vaccines it's a way that we advance public health. And by this, I mean helping to ensure that, all of our eligible infants and of young children receive all the recommended vaccines that our CDC immunization schedule requires them to receive. And so to this end, Merck and Sanofi Pasteur are continually exploring the important roles that, attitudes that circulate around vaccinations, what those are, and then how we can bring combination vaccines into our vaccination schedule to help us with the timely completion of vaccinating.
I was just to add a little bit more to that about what we saw actually in the data that we presented at IDWeek is what we found in our survey amongst U.S. physicians, which included pediatricians and family physicians, was that the maximum number of injections that parents would accept in a single office visit was typically 4, and that parents are more concerned with the number of injections that a child receives than actually the number of disease prevented in one vaccine. And then to follow up just on parental attitudes about vaccination, what we saw was that over 80% of parents reported following their healthcare provider's recommendation for all childhood vaccinations. And amongst parents who asked to delay their child's vaccines, the most common reason was to avoid their child's crying and pain from multiple injections at a single visit.
Parents would rather their children not experience injections or pain as opposed to the protection of the immunization themselves.
Parents, as I said, we had reported that the number of injections that parents typically accept for a single office visit was about 4. And after that, parents would prefer to kind of spread out the vaccines schedule just so that their child would be less likely to have crying and pain associated from the multiple injections. But we really have seen that there's several benefits to combination vaccines and that these vaccines have really been used over 50 years, and they have helped reduce the number of injections and the confusion in the childhood vaccination schedule. So they really have shown to improve vaccine compliance and timeliness. Not only that, they also have had on-time vaccination rates increase with the use of higher valent combination vaccines. So this is really important because if a parent, decides to delay or a child misses a vaccination, this puts the child at risk and increases the likelihood of infections. And so we also have, seen that the benefits of combination vaccines is that they actually improve office efficiency by reducing the need for additional visits to ensure that the child receives their full vaccination status. And this is really important for office practices themselves because this may help reduce vaccine preparation time and administrative tasks. And so that really allows staff to be able to spend more time on patient care.
That being said and understood, as far as the CDC recommendations go, is there a buffer, as it were, to say, okay, if you're going to delay, you can delay this long safely. After this period, we're getting into some bad waters. Is there something like that that exists within those recommendations?
Now, typically, the way that vaccines are actually recommended by the CDC is actually how they're studied in clinical trials. And so the typical U.S. childhood vaccination schedule in the U.S. would be at 2, 4, and 6 months of age for the infant series. And so that's typically what the CDC would recommend, and that's what the practitioners would also recommend for also to ensure that the vaccines are given on a timely basis, and so that children aren't missing out and potentially increasing the risk for infection.
What about parents that are concerned about overwhelming a child's immune system with too many vaccines or too close together? What about those concerns? Either Dr. Mercer or Dr. Goveia?
Sure. So, I think it's a really good question, because it certainly is a concern that parents have. And this is where, I think their relationship with their healthcare provider is really important, and where those conversations that they can have with parents, is important, because current studies really don't support that, multiple vaccines overwhelm the immune system. On the contrary, our, young infants have an enormous capacity to respond to many immunological challenges at the same time, be that in the environment or from vaccines. And, it's by providing that protection actually against any bacterial or viral pathogens or diseases that they may encounter, it actually helps to build their immune system rather than overwhelm it or weaken it, which is perhaps what people may think. And in addition, a child's immune system is really able to respond to a variety of viruses and bacteria at the same time. So we really do benefit them by vaccinating them in combination, especially it's fine, because if we remember, these are really just a small part of a virus or a bacteria is needed to actually, stimulate that immune response. Mm-hmm. So if we can actually get a combination vaccine in where we able to, have a number of those diseases in one formulation, it actually does help. It does what it needs to do for them from a protection perspective, and for all those points that Michelle made, where we actually can help relieve those stresses that patients may be or parents may be feeling, as well as the health system themselves.
Dr. Goveia, when do you think that these combination vaccines will be available?
Well, currently Merck and Sanofi Pasteur are actually working together to in bringing all their joint experience to bring this new vaccine, which is going to be called Varicella, and it should be available for U.S. Healthcare practitioners to use in mid-2021.
Give our listeners a website where we can learn some more, Dr. Goveia or Dr. Mercer, about combination vaccines.
Yeah, the best website that folks can go to is aap.org. That's American Academy of Pediatrics. And then also, of course, the CDC website, which is cdc.gov.
Well, I thank you both for joining us here on Health Professional Radio this evening.
Thank you, Neil. It's been a pleasure.
Thank you very much.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.